Okay, so one of my questions for you, Carolina, is so who are you as a practitioner? I think we all have kind of our unique journey, and I've met, so many different practitioners, and yeah, we have our own unique story. So I'd love to hear a little bit about your story.
Absolutely. Who am I as a practitioner? Well, my practice has always been very patient centered. So even if I'm taking a moment to look at my cheat sheets on my desk or quickly looking up a medication that I'm not familiar with, I'm always keeping the patient at the center of my focus, because that's pretty much why they came to me, is to be taken care of and to get some relief, get some movement on their goals. So yeah, patient centered is how I would say I am in practice. My practice is also trauma informed. So essentially that means that I don't want to make someone's concern for why they're seeing me worse in any way. So I don't want to set off their stress. I don't want to make their pain any worse. And Balance Method actually really allows me to do that, because we're putting needles in places that are actually really quite far away from the main, let's say, pain area. So that's just one of the ways that Balance Method is a really good fit for me and my the way I practice.
Yeah, I think that's wonderful. I had some time to kind of collaborate with you last week, and I think it's fantastic. And again, for people who want to learn a little bit more about Balance Method, why it's very different is, let's say a patient comes in with right shoulder pain, and let's say it's really inflamed and it's in a lot of pain. We rarely put needles directly in that site of injury. Like you said earlier, there's trauma there. Mm-hmm. So one of the brilliant ways that Balance Method works is we find a different joint, right? For the shoulder, sometimes we can use the opposite hip or the opposite ankle to treat that shoulder. And the Balance Method, explains it in a lot of elegance how that works and how it opens up that area and help with from immune cells to just relieving the pain, bringing more circulation. So yeah,
absolutely.
Yeah. Do you have anything else to add to that?
Maybe just to put some of our patients at ease, that we're not going to be going near the area that is painful, so that you're not bracing, right. You're not expecting a stronger sensation. We can actually go somewhere quite far away and give you the pain relief that you're looking for, I should say. Yeah. And so we do have a fun little saying in the Balance Method community. It's that we don't want to poke the bear. So leave the bear sleeping. We're not going to poke the bear. We're just going to do our thing and not disturb the area that is a concern. So
excellent. Yeah.